Great. We are going to start our final panel, which will be a perfect ending for this program. Taking our seats is our moderator, Dr. Risa Lavizzo-Mourey, who's the president and CEO of the Robert Wood Johnson Foundation. Our speakers will be Deborah Cohen, who's a senior natural scientist at the RAND Corporation, Dr. Stephen Gortmaker, professor of social and behavioral sciences at the Harvard T.H. Chan School of Public Health, Kelly Brownell, the dean and professor of public policy at the Sanford School of Public Policy at Duke University, and Shariki Kumanyika, who's emeritus professor of epidemiology at the University of Pennsylvania Perelman School of Medicine and research professor in the Department of Community Health and Prevention at the Dornsife School of Public Health at Drexel University. Lisa, do you want to take it from here?
We are going to try to have a conversation here. We want this panel to be interactive and conversational. It's important to think about the environment. We just heard a lot about clinical interventions, but environments matter as well. We know that even with behavioral interventions, let me go to the next slide here, we only spend a few minutes in a clinician's office, and yet our environment is what we see constantly. So I want to try to set the context by reviewing just a little bit of the information that Dr. Dietz showed this morning, give you a sense of where we are, and this is a slide that shows what's happened with diabetes over the last 30 or so years. You can see that there's some variation, but mostly the rise has been continuous. Childhood obesity shows a similar rise. In the case of childhood obesity, the rise has been as much as 4 times what it was 20 years ago. And diabetes, it's about double. So now if we think about what's happened with our environment over this period of time, Dr. Cohen is going to tell us a little bit about what's happened with the food environment, portion sizes and the like, but let's just think about physical activity. For most of us on the panel, being of roughly similar age group, we used to walk to school. In fact, half of children walk to school in our elementary school times, and now it's about 10%. It may be going up slightly. In the last few years, it seems like there's a slight increase in walking to school. So physical activity changes, and it's changes with age. We know that at about middle school, kids become much less active, and that trend continues throughout adult life. Now, understanding that individual choice is important, clinical interventions are important, but that the environment clearly plays a role. A lot of people, and Dr. Dietz mentioned this morning, began working about 10 or 15 years ago on those 4 strategies that he mentioned. So how has that changed over time? Well, if you look at what's happened with our youngest children, it looks as if we're seeing a decrease in obesity rates. Among those who are ages 8 and above, it's probably leveling off. And as Dr. Dietz mentioned this morning, among the oldest group of children, the rates are still going up. The trend in diabetes is much more decisive. Here we're clearly seeing a decrease in diabetes rates. Now, we are seeing progress. This is an expanded slide of one that Dr. Dietz showed this morning. And what you can see is that in 4 states, those that are in the dark blue, we've actually seen a decrease in obesity rates among adults. The first time that we've seen decrease in adults in 4 states. And we see trends of decreasing childhood obesity in a number of states and cities. That's the good news. The not so good news is that there's tremendous variation across socioeconomic class and race and ethnicity, with a few exceptions. And so let me highlight what's going on in Philadelphia. If you could see on that previous slide, roughly 4.7% reduction in obesity rates among children. And in Philadelphia, that is across all ethnic groups. So what's different about Philadelphia? I think the key here is that it's not one change in the environment. What we've seen is a change in the access to healthy food, more grocery stores, more healthy food in corner stores and bodegas, educational campaigns within those stores. We've also seen a dramatic change in what the school district has done, taking fried foods out of the schools, but also increasing the numbers of fruits and vegetables even before the Healthy Kids Act. The city leaders have made physical activity more available, more bike lanes, more walking trails, and more access to rec centers. So the environment in a place where it's been comprehensively changed seems to be making a difference. Let me turn now to Dr. Cohen to talk to us a little bit about the food environment. And I'll pass that off to you.
All right. Good afternoon.